We ended on the sphenoid bone. I just want us to review the sphenoid bone and then we continue looking at it. Can you see where this guy in yellow, that's the sphenoid bone. Okay. Can you see that the sphenoid bone is part of, are you able to see where my cursor is? There is this joint here where you have got four different bones. We call that as the terion. The sphenoid bone, the frontal bone, the parietal bone, the temporal bone. This region is the terion. It is actually of medical importance. We'll mention it later on. So the sphenoid bone is actually forming part of the orbit where the eye is found, and it is forming also what we are calling as the middle cranial fossa. In the skull where the brain rests, you have got this depression here in the frontal bone. That's known as the anterior cranial fossa. It's a depression. And then this is another depression here. It's just the view of the bone that you can't see properly, but we'll discuss them as topics, the cranial fossa. This is the middle cranial fossa, and the sphenoid bone is forming part of that. And then you have got this depression, which is more down, that is the posterior cranial fossa. So we had said that the sphenoid bone contains four many parts. We have got the greater wing, and this bone looks like a wasp or a butterfly. You have got the greater wings, the lesser wings in green, the body that is in blue, and then you have got the pterygoid processes or process with these ones which are in yellow. The greater wing, what you need to take note is that it has got the three many canals or foramen, the foramen rotundum, the foramen ovale, and the foramen spinosum. I said you can use the gamma simple numeric rows. If you want, you can put an E at the end, but there's no E, right? Rows. R or S. You need to know the order of these canals. The first one is the foramen rotundum, then foramen ovale, and then foramen spinosum. And we said that when you look at the body, just this top part here, this top part, we have got what we call the sella tussica. The sella tussica is going to have a depression, and that depression is where we find the pituitary gland. So it is known as the hypophyseal fossa or the pituitary fossa. Okay, and then in front of the sella tussica, we have got the tubercular sella. At the behind, we have got the dorsum sella. You can see again this bone. Behind here, that's the dorsum sella. In front, we have got the tubercular sella. And then continuing from the from the lesser wing, you can see we have got the anterior clinoid process. And then continuing from the dorsum sella, we have got these prominences, which we call the posterior clinoid process. Another thing you need to know about the body is that this body is actually going to have spaces in it. And because this is the ethmoid bone, we call those as ethmoidal air sinuses. These air spaces, these ones. And these will be opening in the nose. And you can see the hypophyseal fossa where the pituitary gland sits on top there. So the greater wing has got the foramen rotundum, the foramen ovale, and the foramen spinosum. Of importance, what, at least for now, know that the foramen rotundum, we talked of the trigeminal nerve. The trigeminal nerve has got three branches: V1, V2, V3. That's ophthalmic, maxillary, and mandibular branches. The ophthalmic branch, which is the first branch of the trigeminal nerve, doesn't pass in any one of these. Instead, can you see this space? This bigger space here, superior orbital fissure. That is where the V1 is going to pass. And then V2 is passing in foramen rotundum. V3 is passing in foramen ovale. V3 is the mandibular nerve. That's passing in foramen ovale. Foramen spinosum, the important guy you are going to see there, is known as the middle meningeal vessel. These are not the only contents. I've just mentioned them so that you can just know a bit for now, because we're talking about osteology and just bones, because we'll discuss the contents properly. When you look at the lesser wing has got what we are calling as the optic canal. This canal which is here. The optic canal is where the optic nerve, which is the nerve that carries visual stimulus, is going to be able to pass. For you to be able to see, the nerve that enables you to see is the optic nerve, right? So that's where it's going to pass cranial nerve number two. Besides that, also the ophthalmic artery. The ophthalmic artery is the artery that will be supplying the eye. So it also passes there in the optic canal. Okay. And then you also have the superior orbital fissure, this one. It's a very big fissure. It is going to open in the eye. Or together, the optic canal also opens in the eye, just like the superior orbital fissure opens in the eye. And then the pterygoid processes, you have got the medial pterygoid processes, and these ones are going to be able to support the nasal cavity, the posterior opening of the nasal cavity. And then the lateral pterygoid processes, these ones are the site of the origin of the medial and lateral pterygoid muscles. You are going to understand these muscles. So just take note that the lateral pterygoid processes, there is attachment of the medial and the lateral pterygoid muscles. The medial pterygoid is forming part of the nose. Before we continue, let's see if we can answer some questions. Foramen spinosum conducts the middle meningeal vessel. Where is the sphenoid? Where in the sphenoid bone is it found? So where is the foramen spinosum found? Body, greater wing, lesser wing, pterygoid process. Anyone that can answer that? Where is the foramen spinosum found? Okay, you can answer that question. So the next bone is the ethmoid bone. Ethmoid bone, you can see where it stays, just somewhere here on the nose. Okay, that's the ethmoid bone. You can see the way it looks, not too good, and it has got some parts that we have to know. The top part here is known as a crista galli. It's of importance. We'll talk about the importance. And then it has got the cribriform plate part of the horizontal plate. So actually the ethmoid bone, cranial nerve number one, the one that carries smell sensations. That cranial nerve is going to be living because it projects, it comes actually from, it just hangs like the tumor nerves hang in the nasal cavity. It's going to penetrate the nasal cavity and then go into the central nervous system, the brain. And it will actually pass on the cribriform plate. Okay? Cribriform plate of the ethmoid bone. So please take note of that. That's important. It's actually here when you are swimming. We'll talk about this. This is the next topic we will be doing in microbiology. We have got a parasite which is known as Negleria fowleri. If you are swimming, it will be able to enter, like these parasites are found in water. They can enter through your nose and they'll pass through the cribriform plate, and then they'll move through cranial nerve number one, and then they'll go to the central nervous system to cause infection. The ethmoid bone also contains sinuses. They contain these air spaces, and we call them ethmoid sinuses, just like we had for the frontal bone, we had the frontal air sinuses, and then for this bone, this one, the sphenoid, we also have the sphenoid air sinuses. You can see we have got the middle nasal concha. Actually, also the superior nasal concha. Remember, we said that the inferior nasal concha is a bone on its own, but the middle nasal concha and the superior nasal concha are actually part of the ethmoid bone. You can see this. This is the superior concha. This is the middle concha. They are part of the ethmoid. Can you see these tumor openings which you can see on top of this bone? This is what we call the cribriform plate. It has got these openings in the cribriform plate where the cranial nerve number one will be able to pass. the nerve that enables us to be able to smell. The inferior nasal concha, this one down, is a different bone. And then on the middle, you have got what we call the perpendicular plate of the ethmoid bone. Okay, you can see again cranial nerve number one, with this one here passing through, that's the olfactory nerve. So these are the olfactory fibers which are passing through the cribriform plate, and then on top they are going to form the olfactory bulb, which now will continue as the olfactory tract. Remember, a tract is a collection of cell of axons in the central nervous system. So as we are saying, the ethmoid bone has got different parts: the cribriform plate, the perpendicular plate, and then two ethmoidal labyrinths. The cribriform plate is going to form the roof of the nasal cavity, as we have said. This on top here, that's the roof of the nasal cavity, like the top of the nasal cavity, and it's going to be pierced by numerous olfactory nerves, nerve fibers. The olfactory nerve is not just alone. There are a lot of them which will pierce the cribriform plate, and then they will join to form the olfactory bulb, which will now form the olfactory tract to go to the central nervous system. Projecting on top of the cribriform plate is what we know call as a crista galli. Okay, crista galli. On top here, just on top here, somewhere in front, that's where we're going to find the crista galli. The crista galli is going to be one attachment for the falci cerebri or cerebri. This is a tent that will be separating the left hemisphere of the brain from the right hemisphere of the brain. So you need to please take note of that. And then the perpendicular plate is going to descend from the cribriform plate. It is going downwards, and it will form part of the nasal septum. Can you see this? Can you? This is the nose. This is the nasal septum. The septum is more like a, can I use the word dent, that will be separating the two sides of the, the nose has got these two nostrils, but on the middle, right? That's the nasal septum. The nasal septum has got the part that is bone, and then majority of it is actually cartilage. So part of that bone is going to be the perpendicular plate just on top here, just on top, somewhere on top there. And then you have got the ethmoidal labyrinth. These are basically masses on each side of the perpendicular plate, and they contain the ethmoidal air sinuses, okay, or air cells. And each one of these masses, these bones are going to form the orbital plate and the medial sheet. In other words, part of this bone is actually found in the eye, and part of them is going to be found on in the nose. Okay, this same ethmoid bone. So you can see again here, that's the superior concha, that's the middle concha, which is part of the ethmoid bone. And then this is the crista galli, where the falx cerebri will be able to attach. And you can see, if you look at it from the front, when you like cut a person with that coronal section, you can see the middle concha here. The superior concha is supposed to be on top. This is the inferior concha. This is the nasal cavity here. Okay, you can see the superior concha, which is on top. And then the medial sheet, which is this one, this side, which is forming the lateral wall of the nose. Please, lateral, on the side of the nose. And then we also have the orbital plate, this one, the orbital plate here, which is forming the medial wall of the orbit. And then you can see that in these two masses, you have got the ethmoidal hair cells. Okay. And then you can see this blue thing here, that's the cribriform plate. And then just on top here, that's where cranial nerve number one will be coming from, on the cribriform plate. So sometimes there can be a fracture on the cribriform plate. And you can see down here you have got the nose. On top, you actually have the brain, just on top here. And you know the brain is covered in meninges which contain cerebrospinal fluid like the dura mater, the pars mater, the arachnoid mater. There is cerebrospinal fluid there. So what happens that if you injure the cribriform plate, what is going to happen is that cerebrospinal fluid will start moving from the central nervous system to be dropping in the nose, and that is known as the CSF rhinorrhea. Okay, rhinorrhea. This is where someone is having a running nose. So there is a running nose if there is a break here, and we are going to see this as a white fluid that is draining, or a clear fluid that is draining. The next bone we should understand is the mandible. This big bone here is actually the only movable bone that is found on the skull. It has got the body and the ramus. The body of the mandible is the biggest part. You can see the entire of this from here to there, that's a body. And then from here going there to, that's the ramus. At this point where it is turning, we call it the angle of the mandible. That's the angle of the mandible. When you look at the body, there is actually the middle part that's known as a mental protuberance. Like on the middle here, there is a protuberance, something that like comes out. That's a mental protuberance. Okay. And then we are also going to have on the sides of the mental protuberance, we are going to have what we call the mental foramen. Mental foramen on the sides. Can I show you? Can see these ones here, this one and this one. Those are the mental foramina. There is actually nerves that pass through there. Which nerves are those? So the inferior alveolar nerve, and if you hear alveolar, alveolar refers to the teeth. So inferior alveolar, because like you have got the teeth on top, right? So inferior, isn't it? So the inferior alveolar nerve and artery will actually exit what we call the mandibular canal, and when it passes through the mandibular canal, this guy is now going to pass through the mental foramen. Immediately, this inferior alveolar nerve and artery passes through the mental foramen. The name changes from inferior alveolar to mental nerve and artery. And this is the one, the nerve that will be innervating the skin of the lower lip and the front of the chin. You can see again. Can you see this canal on the inner aspect of the mandible? That's the mandibular foramen. That is where the inferior alveolar and the artery and nerve will be able to pass. And then when, because it is going to continue and get to come out from here, immediately it comes out, the name changes into mental artery, mental nerve, mental vein. Even the vein supposed to be there, they normally move the three of them. When you look at the ramus of the mandible, it is the one that is marked by the mandibular foramen that we are just from describing now. Okay, so the mandibular foramen, you are going to have again the inferior alveolar nerve, inferior alveolar artery, even the vein, you expect it to be there. They are going to travel through the mandibular foramen into the mandibular canal, okay, and exit via the mental foramen. So they are starting from where? Mandibular foramen, and then mandibular canal. Mandibular, this is the foramen, and then you are going to have the canal, and then you are going to come out from this foramen again. Okay. So that is at least what you need to know about the mandible. Let's look at the other parts of the mandible. Can you see that when you look at the ramus? Please take note, okay? The posterior aspect of the ramus of the mandible, that is known as a condylar process. The anterior aspect is known as a coronoid process. This bone can come in your practical test, you label some parts. And then you have got the sublingual fossa there for the sublingual gland. Again, when you look at the condylar process, it has got the head and it has got also the neck. Okay. And then we have got the occipital bone, which is this scama bone at the end here. The occipital bone has got also some canals. It has got actually different parts. It is trapezoid in shape. It has got the squamous part. This whole part here is the squamous part. That's the majority of the part. Okay. And its It's here. It is going to border the parietal and temporal bones. Like if you look at this one, can you see that it's attached to this part on top here, which is the parietal bone, and then on the sides it's connected to the temporal bones there. Okay, that's important. And then another thing is that it's going to form the posterior part of the foramen magnum. Posterior part, you can see, because the squamous part is on the posterior aspect here. Like this is the back, this is the front. So it forms this foramen, the biggest foramen where the spinal cord passes. That's the foramen magnum. This one, it's forming the posterior aspect. And then you have got the condylar part of this occipital bone. And this condylar part is going to form the lateral sides of the foramen magnum, and it comprises two occipital condyles. These condyles that you can see here, these are the parts where the first is cervical bone C1, which is the atlas, is going to be able to join here, forming what we call the atlanto-occipital joint. This is where it is going to be able to attach. And then you have got the basilar part, which is this anterior aspect here. It forms the anterior aspect of the foramen magnum. Okay. So can you see that the condylar part also contains what we call the hypoglossal canal. The hypoglossal canal is going to allow the passage of what we call the hypoglossal nerve, that is cranial nerve number 12. It is going to pass here when it is coming from the brain. Is there any question up to here? Any question? Okay. So we are saying the hypoglossal canal, the hypoglossal nerve will be able to pass there. Actually, it is the exit when it is coming from the brain. You can see these spaces on the this. So here is the foramen magnum. The hypoglossal canal is just next to the foramen magnum, just on the sides. You also have another foramen here, which we call jugular foramen, but it is more lateral. Okay, that's the jugular foramen. So, what are the other contents of the hypoglossal canal apart from the hypoglossal nerve? We also have what we call the ascending pharyngeal artery. This is also important. We'll discuss them as we talk about the branches of the internal carotid. Okay, so the ascending pharyngeal artery is also passing through there. The jugular foramen, this one lies lateral to the hypoglossal canal, as you can see, and is located at the junction of the occipital bone and the hard part of the temporal bone. We call that as the petrous part of the temporal bone. Okay, there. And it is actually in this canal where you are going to have cranial nerve number 9, cranial nerve number 10, and cranial nerve number 11 passing. That is in the jugular foramen, because cranial nerve number 12 is passing in the hypoglossal foramen. Besides that, you also have veins passing through the jugular foramen, like the internal jugular vein and what we call the sigmoidal sinus. You understand this very well. Other structures that will pass there includes what we call the jugular bulb, the Jacobson nerve, Arnold's nerve, the cochlear aqueduct. But at least make sure that you don't forget the veins and the arteries. The external surface, like the posterior aspect of the occipital nerve, you have got the supreme. It has got nuchal lines, supreme nuchal line, superior nuchal line, median nuchal line, inferior nuchal line. The supreme nuchal line is the attachment for what we call the epicranial aponeurosis, which we had mentioned earlier on, that it connects the occipital belly of the occipital frontalis muscle to the frontal belly of the occipital frontalis. You also have the superior nuchal line. You have got a lot of things which are touching here, and the superior nuchal line has got a prominence which is known as the external occipital protuberance. And you have got actually some muscles attaching here, like the splenius capitis, trapezius muscle, and the occipitalis. The median nuchal line is the attachment from the nuchal ligament, which is a very big ligament of the back. And then you have got the inferior nuchal line, where there's going to be attachment of the obliquus capitis superior, rectus capitis posterior, minor, and major. We'll discuss this muscle, so for now I don't want you to worry much about them. So you can see the superior nuchal line here, and then you have got the inferior nuchal line. On the middle here, can you see you have got the external occipital protuberance at that point. Okay. And then when you look at the inner aspect of the occipital bone, it is making like a cross. These same things that you can see, these same lines that you can see outside, that's what you're also finding inside. But inside, they are forming protuberance where there's going to be connections of dural folds. The dural folds, these are folds of dural matter. All right. So you have got the groove for the transverse sinus, even from the word transverse, it's supposed to run transverse like that. That's a groove for the transverse sinus. You are going to know properly the transverse sinus. And then you have got the groove for the superior sagittal sinus. This is the one on top here, superior sagittal sinus. And then you have got the internal occipital crest or occipital sinus, okay, which is the one which is a bit inferior here. And this is going to be the attachment again for the falx cerebri, the inferior attachment. So what we are talking about, as you can see, this is the tent I've been mentioning all this while. That's a falx cerebri, which separates the brain into the left hemisphere and the right hemisphere. And then you have got this tent here. Down it, you are going to have the cerebellum. On top, we are going to have the cerebrum. We call this as the tentorium cerebelli. Okay. And then you can see on top here you have got this vein, this big vein. That's what we call the superior sagittal sinus. And we are saying the superior sagittal sinus is forming a groove. Also, this groove that you can see here is being formed by this same big vein here, the superior sinus. And then you have got the transverse sinus. This is the one here. You have got the one on the left and the one on the right. But this is going to be a topic for another day. And then the internal surface of the basilar part, you remember the basilar part is the front part of the occipital bone, has got what we call a shallow groove, which is known as the cleavus, okay, which is this gamma groove here. That's the front aspect. This is going to be able to support the medulla oblongata and is going to be part of the attachment for what we call the tectorial membrane. The foramen magnum is the biggest magnum, or the biggest opening of the brain and of the skull, and there are a lot of contents that pass there. For example, you have got accessory nerves, vertebral arteries, anterior and posterior spinal arteries, the ala ligament. This ligament is important for the attachment of the bone C1 and C2. The tectorial membrane, the spinal cord, they are all going to be able to pass there. Okay. And then lastly, on the bones of the head and neck, we look at the bones of the head. We are only of the neck, only interested in the cervical bones. You can see the cervical bones. You can see the properties starting from this is how they look. They have got a very big body, and then you have got this opening where the spinal cord is going to be passing. Can you see that it is triangular? All right, different from the thoracic where it is more round. When you look again at the vertebral bones, they form curvatures. You have got the anterior curvatures in the cervical and the lumbar. We call these as the primary curvatures, and then the posterior curvatures. These are actually secondary curvatures. Primary is the one that looks like a lordosis. We know a lordosis, right? When a baby is born, it's like round as though is tied. Think of someone that is squatting, not really squatting, but you are trying to put your head between your legs. So the way you look like that, that is a primary. Okay, that's the primary curvature. The primary curvature is found in the thoracic region and the sacral region. When you look at the vertebral column, the typical vertebrae is going to have two many parts, the vertebrae body and the vertebral arch, which is also known as the neural arch. This vertebral arch is going to have two pedicles, and then it's also going to have the lamina, which will be able to fuse. And then you're also going to have the vertebral canal or vertebral foramen. Okay. The vertebral foramen is going to run all the way from C1 to the very last bone. You can see this is the bone, this is a vertebral body, which is found anteriorly, and then posteriorly you have got the vertebral arch where you have got different parts. You have got the transverse process on the sides, and then you have got the lamina here, the spinous process at the back. If you look at it on the sides, you can see you have got the pedicle here. The pedicle is connecting the vertebral arch to the vertebral body. The lamina is connecting the spinous process. And can you see that you are going to have articular processes? This is to be able to articulate with the different parts of the other bones, the inferior articular process and the superior articular process. You can see the vertebral canal is the very middle there, where you are going to have the spinal cord passing there. Also the meninges, because the spinal cord is surrounded by the meninges, dura mater, arachnoid mater, and pia mater. You also have blood vessels, connective tissue, fat, and also spinal nerves. These nerves that are coming out, those are the spinal nerves. A typical cervical vertebrae, how does it look like? So the vertebral body is going to be short in height and square shaped. When you view it from the top, you can see it is longer on the sides, so it's square shaped. Each transverse process is going to have what we call the foramen transversarum or the transverse foramen. Can you see there? This is the cervical region. And then the spinous process is short and bifid. It has got two parts. It is short. The vertebral foramen is it triangular. These are the features for a typical vertebrae bone. They are typical ones. We have got C1, which is the atlas, C2, which is the axis, and C7, which is known as the vertebra prominens. These ones don't, they are going to have slightly different features from those that we've mentioned. C1, which is the atlas, is going to be able to form a joint with the occipital bone, all right, and that will be the antranto-occipital joint. This joint allows us to nod when you want to say yes. And then there's also going to be a joint between C1 and C2. That joint allows you to turn your head to the left and to the right. C1, when you look at its shape, it's a ring-shaped bone. It has got no body and it has got no spinous process. It has got these lateral masses, okay, and then it's going to connect with C2, which is the axis, forming the axial and trantoaxial joint. The axis, which is C2, also you can see it has got one prominent feature here, which is the dens. The dens is actually believed to have been part of C1, and then during development it ended up attaching here. Okay, so the dens is also known as an odontoid process, odontoid process. And then you can see they form the atlantoaxial joint, which is this joint, and then you have got the transverse ligament that is stabilizing this joint there. You are also going to have some other joints. And then C7, the vertebral prominence. This one is an important bone because it's a landmark. If you want to start counting the vertebral bones, you can actually feel it at your back. The most prominent vertebral bone that you'll be able to feel in your neck is C7. That's where you start counting the vertebral bones from. You can see it as a very prominent spinous process which is not bifid. Okay. So that is that for osteology of the head and neck.